Hi friends, welcome to Easy Learn. So today, as a first video, I have decided to do about the blood supply of the face. We will be talking about the arterial supply as well as the venous supply in a very simple and easily understandable manner. Okay, so blood supply of the face. Let's begin. So first we will be dealing with the arterial supply of the face. Okay, so what I have drawn here, this is the hyoid bone. Okay, so this is the hyoid bone. This is the pictorial representation, and this is a greater corner of the hyoid bone, this is a lesser corner. So at the tip of the hyoid, this is the external carotid artery, it will be coming, and at the tip of the greater corner of hyoid bone, it will be giving off the facial artery. So facial artery is the external carotid artery. So wait, as an introduction, let me tell the dealing with the blood supply. First we are dealing with the arterial supply of the face, and mainly there are two arteries which are supplying the face. Which are they are the facial artery, and then second one is the transverse facial artery. Okay, so it's a facial artery and the transverse facial artery. Okay, transverse facial artery are there. Okay, so first we are dealing with the facial artery. So we have already discussed about the origin of the facial artery. It is originating from the external carotid artery at the level of tip of greater corner of the hyoid bone. Okay, now let's come to the course. So this is what am I drawing here now. This is the mandible, just a diagram of mandible. Okay, so this facial artery, it will be entering into the face at the center point of base of mandible. At the center point of this base of the mandible, it will be entering into the face. It will be winding around that and it will be entering into the face. Then what happens, it will be ascending, and while it is ascending, it will be 1.25 centimeters away from the angle of the mouth. Okay, so from the angle of the mouth, this facial artery will be ascending 1.25 centimeters away, means lateral to the angle of mouth. Okay, lateral to the angle of mouth. Okay, then what happens, then it will go like this. It goes on ascending in the side of the nose, and then how does it end? It ends by anastomosing with this is the dorsal nasal artery. Anastomosis with the dorsal nasal artery, which is a branch of ophthalmic artery. Okay, so this is how it ends. Okay, it ends by anastomosing with the dorsal nasal artery branch of ophthalmic artery, where you can clearly say that near the medial angle of the eye. This is the eye. This is the eye of that person. Okay, I'm very poor in drawing diagrams, but I guess you guys are able to understand. And the medial side of angle of the eyes, this will anastomose with the dorsal nasal branch of ophthalmic artery, and thus the facial artery ends there. Okay, now let's discuss about the branches of the facial artery. Okay, so there are just simply in the face, there are just three branches for the facial artery. Okay, so which are they? Which are the three branches of the facial artery? Let's see. They are the superior labial, the inferior labial, and the lateral nasal. Okay, superior labial, inferior labial, and lateral nasal. Superior labial obviously going into the upper lip, inferior labial obviously going into the lower lip, and the lateral nasal, which will be supplying the ala and the dorsum of the nose. Okay, so let's write over here which are the three branches of the facial artery. Which are the three branches of facial artery in the face? Just repeat after me. Along with me, just repeat that. They are the superior labial, then there is the inferior labial, and the lateral nasal. So what is the superior labial supplying the upper lip, as the name suggests. Inferior labial will be supplying the lower lip, as the name suggests, and lateral nasal will be supplying the ala and the dorsum of the nose. Okay, so that's about the facial artery. And now let's also talk about the anastomosis of the facial artery. So these three branches which we have told here, they are actually the anterior branches. Okay, so they are actually the anterior branches of the facial artery. Apart from it, there are also some unnamed posterior branches also are there for the facial artery, about which there's no need of talking because they're unnamed and they're insignificant. Okay, so these anterior branches, they will be anastomosing with the corresponding branches which are present on the opposite side of the face. Okay, so let's draw the branches alone. That is, the superior label will be anastomosing the superior label which is coming from the opposite side. Then the inferior label will be anastomosing with the inferior label coming from the opposite side. The lateral nasal anastomosis with the lateral nasal of the opposite side facial artery. Okay, and then that main trunk, we know it ends by anastomosing with the dorsal nasal branch of ophthalmic artery at the middle angle of the eye. Okay, then we told there are the other anterior branches, and there are some unnamed posterior branches also. Unnamed posterior branches, the anastomosis with the transverse facial artery, okay, about which we'll be talking the next. Then it is the next significant artery for the arterial supply of the face. Okay, so unnamed posterior branches, anastomosis with the transverse facial artery in the face. Okay, so that's all about the facial artery. We can just revise that. Facial artery originated at the tip of greater corner, fired from the external carotid artery. Then it ascended at the central point of the base of mandible, 1.25 centimeters lateral to the angle of the mouth. Pardon me. Then it ascends at the lateral side of the nose. Then it anastomoses and ends. These are the branches. And how does the branches anastomose? We have told about that. Now let's talk about the next significant artery of the face, that is a transverse facial artery. Okay, so the transverse facial artery, it is a branch of the superficial temporal artery. So we all know superficial temporal artery, it is the smaller terminal branch of this is okay, this one is the superficial temporal artery, which is a smaller terminal branch of the external carotid artery. Okay, it's a smaller terminal branch of the external carotid artery, and the larger terminal branch is a maxillary artery, about which we'll talk about in another video. Okay, so the superficial temporal artery, this transverse facial artery, is a branch of the superficial temporal artery. Okay, and then another, we have to learn about the relations. When coming to the relations in textbooks, many relations are being said, but we just need to know about two things. It is lying between the zygomatic arch above and the parotid duct below. Okay, zygomatic arch is a part of the zygomatic bone, and the parotid duct, we know it's the duct of the parotid gland. Parotid duct, the Stensen's duct is a duct of the parotid gland emerging from the anterior border of parotid. Okay, so that in between these two, and also this will be passing superficial to a muscle. This will be passing superficial to a muscle here. The transverse facial artery will be passing superficial to a muscle here. Now, which is that muscle? That is the masseter. Okay, so you guys would have noticed the color code that I am using. Now, during exams also we should be using this color code, because it is the code which is approved by the universities. If you use something else, they may not give us the correct deserved amount of marks. For muscles, we should use brown. For arteries, we should use red. For veins, blue. For nerves, we should use yellow. And for ligaments and fascia, we should use green. Okay, that is color code which is accepted. So now the transverse facial artery is passing superficial to the masseter, and it will be accompanied by a nerve. It will be always accompanied by a nerve in above it, that is the buccal branch of the facial nerve. Okay, so we can talk about the facial nerve in another video. And now I guess that you guys know that the facial nerve is having 5 terminal branches, and these will be emerging from the anterior border of the parotid gland, just as a shape of an goose foot. Yes, goose foot. The 5 terminal branches are 5 terminal branches are the temporal, the zygomatic, the buccal, marginal mandibular, and the cervical. Okay, so they'll be emerging through the anterior border of parotid gland. This is the parotid gland which I have drawn just for understanding purpose. Okay, so between this parotid gland and the zygomatic arch, the transverse facial artery will be going into the superficial to masseter. Okay, now what is the branches? There's some unnamed small branches only. Thus they are not significant. Now, how does it end? We already have told, when we discussed facial artery, we have told that the posterior unnamed branches of the facial artery will be anastomosing with the transverse facial artery. So that's how it ends. It ends by anastomosing with the the posterior unnamed branches of facial artery. Okay, so we with that we have finished the arterial supply. Okay, so let's look a diagram of a face. So this is the diagram. I hope you guys can see that. Okay, so look at this, look at the diagram. Where is the facial artery? Yeah, this is the facial artery over here. You can see the facial artery over here. Sorry. So you can see the facial artery over here. It is, we have told, it is passing the central point of the base of the mandible. Then the branches, the inferior labial, superior labial, lateral nasal can be seen here. Okay, and its ending is not so clear. Okay, then we can talk about the transverse facial artery. Here you can see that the parotid duct is seen here. We have already told the transverse facial artery passes above the parotid duct, and here you have the zygomatic artery also. Okay, so that's the arterial supply. Now let's talk about the venous drainage of the face. So venous drainage of the face is just simple. It can be discussed just with this diagram. Just one diagram is necessary. Just we can just learn it as in hierarchy. So the first one we have to learn about is the yeah, look at here. This is the superficial temporal vein. This one over here. This is a superficial temporal vein. Okay, superficial temporal vein. This will anastomose with the maxillary vein. Okay, superficial temporal vein anastomosing with the maxillary vein to form the retromandibular vein. Okay, so superficial temporal anastomose with the maxillary vein to form the retromandibular vein. Okay, now this retromandibular vein, imagine this is that it will be dividing into two branches, an anterior division, not branches, two divisions, an anterior divisions and a posterior. This is the retromandibular vein. It is dividing into an anterior division and a posterior division. Okay, you can see it over here. Here you can see the retromandibular is dividing into an anterior division and a posterior division. Okay, now what is going to happen? Now let's erase it so that we can view easily. Now this anterior division of the retromandibular vein, this is the anterior division. It is coming and it is joining with the facial vein. Okay, so before that we should talk about the facial vein. Okay, how is that formed? So that we can see over here. Let's draw that. Let's draw a face. This is an imaginary face of a person. Oh, sorry, this is so bad. I'm really sorry. Of a person I have drawn over here. This is his eyes. Just take it as a face for the time being. You have two veins here. We would have learned it when learned about the venous drainage of the scalp. We have the supraorbital and the supratrochlear veins. So these two veins, they will be joining in the medial angle of the eye, okay, to form the angular vein. And this angular vein continues as the facial vein. This is supraorbital, this is supratrochlear, this is the angular vein, and this will be continuing as the facial vein. Okay, so you got it. Supraorbital, supratrochlear, angular vein, the medial angle of the eye, and the facial vein. Okay, now let's go back to this diagram. So that's how the facial vein has formed. So this is seen in this figure also. You are able to appreciate that over here. You can see that this sorry, I just messed up things. Over here you can see the supraorbital and the supratrochlear being the angular vein and forming the facial vein. Now this is the facial vein. Okay. Then what happens? This facial vein joins with the facial vein is going to join with the anterior division of the retromandibular vein to form the internal jugular vein, and the posterior division of retromandibular vein joins with posterior auricular vein to form the external jugular vein, which drains into the subclavian vein. Okay, so just simple. Just as I am drawing, please go through the figure also, so that you will be able to appreciate that. Okay, so that's the venous drainage of the face. So with that, we have completed the blood supply of the face. Thank you for your patient listening. Please do like, share and subscribe this video if you find it useful. Bye. Let's meet with another easy learn video of a small topic easily explained in an easily understandable way. Bye.